Hello and welcome. You are watching the Urban Debate here on Mirror Now. This is Krishna Kumar. Today on the Urban Debate, we are focusing on an epidemic silently ravaging our country. Over 1 in 20 Indians, about 5 crore people in all, suffer from this disease. You probably already know someone who is a silent sufferer, but chances are you do not know that person is in fact unwell. The reason? We do not talk about this disease. For years, we have hidden it, brushed it under the carpet, ignored pleas for help, only to confront it when it turns fatal. When all you need to do to help those suffering with this particular disease is just talk. On the Urban Debate today, Mirror Now is talking about depression, especially depression among youth. And for that discussion, we have with us a couple of very special guests. I'm going to introduce them. One is Dr. Sagar Mundada, who's a psychiatrist and a youth wing head at the Indian Medical Association, IMA. Dr. Sagar Mundada, thank you so much for taking time out to be with us over here. We also have very young Siddharth Dudeja, who's a stand-up comedian and has worked extensively with AIB. Siddharth, thank you so much, man, for taking time out to be with us over here. And we also have Dr. Varka Chulani, clinical psychologist and psychotherapist at the Lilavati Hospital in Mumbai. Dr. Varka Chulani, thank you so much for taking time out. We have more people joining us, but let's just start this discussion. I'm going to go to the psychiatrist first up. Dr. Sagar Mundada, you are a youth, you are a young man in your own right, but you're also a psychiatrist, and we're having this discussion simply because of what we witnessed just a couple of days ago in the form of 23-year-old Arjun Bharadwaj, who committed suicide from the Taj Lands End Hotel in Mumbai, in Bandra. That suicide has led us to this question that we should have been asking for a very long time. I want to understand, depression is a very large, vague term. When you see something like an Arjun Bharadwaj case, what thoughts do cross your mind as a psychiatrist?
See, the first thing that I would say, sir, is what Arjun did. I think it was a big cry for help. He must have been crying in some other forms for help, but sadly, as a society, we could not identify it. And I can tell you one thing, that this is just the tip of the iceberg. Every day in our OPDs, we get patients who come to us when they are in such a bad mental state. The reason being, in the early stages of depression, nobody really pays attention to it. Second thing is, nobody really realizes that it could be depression, it could be a mental health issue. Even if you do realize that it is a mental health issue, still the taboo that is surrounding this disorder in our country, sadly, is so much that we choose not to go to the doctor, we choose not to take professional help. And I think that is why this incident has happened. This is just the tip of the iceberg. Incidentally, tomorrow we have the World Health Day, on which we are talking about depression. Let's talk. I think the theme is really wonderful. Depression, let's talk. If you just do this one thing, that is, you just talk. First of all, you have to talk on a larger scale, because this, as you very correctly said, is a silent killer. Nobody really talks about it. There are only whispers. There is only talk about it in closed rooms. Nobody is really ready to come out in the open, at least on a larger scale. That is one. And the second thing is, if you talk to somebody, as they are saying, let's talk, the chances that you'll get depressed, the chances that you'll suffer from such a disease, I think really go down. So I think it's a wonderful theme that has been kept by the WHO, and it's very pertinent too, because as the WHO has said, that more than 30 crore people all around the world are suffering from this menace at this very instant, out of which more than 5 crore are from our very own country, and I really doubt even half of them might be getting treatment or not.
5 crore is a massive number, Dr. Sagar Mundada, isn't it? It's good enough for 2-3 states in this country, 2-3 small states in the country put together, and to form a fairly large state. 5 crore Indians, keep in mind, 1 in 20 Indians suffer from depression. That's the reason why Dr. Sagar Mundada was making the point that World Health Organization is keeping depression, let's talk, as a theme of the World Health Day this time around. I'm just going to go to Dr. Varka Chulani as well before we take it to Siddharth. Dr. Varka Chulani, as a clinical psychologist and psychotherapist at one of the premier hospitals in Mumbai, I want to understand what your experience has been like, because just a few minutes away from your hospital is where this latest case of a suicide due to depression has taken place.
Yeah, so if you listen to the data which was provided by the newspapers, and that's all that I've really read, okay, he did reach out to his parents and tell them that he was disturbed. Unfortunately, I think a large part of untreated mental illnesses go untreated because as parents we are not paying enough attention to what our children tell us. So it's very well to say let's talk, but who is there really to listen to a youngster when he wants to pour his heart out? I think in an urban scenario, especially in modern day age where everybody's so busy on WhatsApp chatting frivolous things, when actually a child is reaching out to you and asking you to listen to them, the parent is either too involved, too busy, or just completely dismissing what the child has to say. And I think a large part of emotional trouble may not necessarily be chemical and is largely a result of the busyness of our everyday lives, actually busy doing nothing if you actually see the productivity and the output of what we produce every day. I think the whole gamut of keeping up with the Joneses, running after materialism, that the human being today unfortunately is being isolated, is being alienated, and has really no one to connect to. So talking is very well because we're doing it all the time on WhatsApp and on chats, but we are talking superficial, we are talking inane, we are talking nothing of sense, nothing of purpose. And I think if we really want to prevent any emotional illness, I think the World Health Organization needs to empower the families to first connect with each other. Meals had together, discussions around a dinner table, these are all old things which old families did in the joint family system, etc. Today, everyone's sitting in front of their idiot box, sitting in their individual rooms with their iPads and trying to eat and watch things which are actually of no consequence and are pretty irrelevant to well-being. So I think a large part of what happened, unfortunately, a few days ago, I would possibly want the parents to sit back and really reflect and take some kind of responsibility as to what was the connect that they were having with their child, what is the connect that we of parents today have with our children. Is parenting only about providing? Is parenting only about giving them the best gadgets? Is parenting only about taking them for fancy holidays, buying them the best clothes and just indulgence? I think parenting goes much deeper than that, and I think it's our responsibility, if we decide to be parents, to be sensible ones and to absolutely engage with our young toddlers right from 0 years up. And as they grow up, the teenager needs more of us. I know he rebels, he's very aggressive, he gives us an impression that he hates us, but that's where a mature parent comes in, holds his patience, tolerates the tantrums of the teenager, and does whatever it takes to connect with the teenager. I think if we can start a talk going in that direction, we would prevent many future suicides.
Absolutely, Dr. Varka Chirani, you raised two very important questions. One is the job of parenting. We can easily go on to a point where, if anybody were to look at that video, Facebook Live video, a lot of people will be like, he's a young guy, what is he doing? He shouldn't be committing suicide, and blame the victim for it, in fact. But the question you raised is, how good is the parenting these days? That's a massive question that you raised. We will try to get some answers on that front. How crucial is the role of parenting? And that too, and that associates the second question you've raised, is what is happening on social media and all these messaging apps and all the use of technology which is taking away the human connection. And more importantly, taking away the human connection means conversations that are meant to be had are not had. Two very important points you've raised, in fact, following up from what Dr. Sagar Mundada said. So, before we get to the other panelists, we do also have Dr. Harish Shetty, psychiatrist, joining us here in the Mumbai studio. We also have Varun Agarwal, an author, joining us from Bengaluru. And we also have Sana Iqbal, biker and anti-depression and suicide speaker, joining us from Hyderabad. I'm going to welcome them to the urban debate as well. Before we get to them, we're talking to two psychiatrists and clinical psychologists. Now, let me get in somebody from the age group. Somebody who's 24 years old, who's a comedian right now, and has in fact worked extensively with AIB, where AIB's Tanmay Bhatt has been, in fact, one of the most vociferous speakers on the social media about the Arjun Bhardwaj suicide that happened 2 days ago. Siddharth, we were just having a chat before this discussion began. And I'm a big lover of comedy, but I also know that from Charlie Chaplin to any single comedian today, comedy comes out of pain experienced before. Sort of converting that into art essentially becomes comedy. Every comedian in the world ever has been through some really difficult experiences. As somebody who has done it successfully, you're a successful stand-up comedian now. How do you see this when somebody of your age, with such education, does something like this?
Yeah, first of all, like successful is like kind of subjective. I'm not a successful comedian, but like the point is, the simple thing
you have a
is,
career as a comedian and that is successful enough.
yeah, but the point is that like comedians generally are the most depressing people. Like they're completely depressed within themselves because the kind of low self-esteem that comedians carry, it's like that's the reason they go on stage to get validation every day from people. Like the fact that a comedian who has some jokes written down, who's ready to go on stage and experiment it with an audience who might or might not laugh at you, it's kind of a very depressing thing, and it's a very individual thing where you are on stage, so you are sharing the success all by yourself as well as the failure of the joke. So it's kind of very individualistic, kind of depressing. But like as a 24-year-old, when I saw this news, I was really depressed because especially the most important part of this social media is that like social media is such a fast, like you're seeing 10% you're seeing the good things that people share on social media. Like I am here today, I'm going to share this video later on with people, but nobody knows what I did in the whole day today. Like nobody knows I was just sitting at home and getting depressed, probably like trying to write jokes, not getting anything. You just see the me where I'm at a bath and I'm here in the studio right now talking to you. Like you see people sharing stuff. So it's just the 10% that you're seeing of the good things. Like everyone is depressed, but they tend to show like a very superficial version of themselves. Like nobody wants to share a photo of, everyone wants to share like cool things, like he had spaghetti for lunch. I've never seen anyone share like, say, yo bindi, I had this for lunch. Like, so it's very superficial.
And also nobody says like, I just lost a job or I just, had a really bad experience. It's always about how awesome life has been, and life cannot possibly be that awesome all the time.
Exactly.
Siddharth, I'm going to come back to you and explore more about what it is and how to get through the social media age, which can create mental illusions and delusions. Dr. Harish Shetty is also with us. Sana Iqbal is also with us. I'm going to take this quickly to Sana Iqbal. Sana, we just were seeing quotes of Deepika Padukone, who came out openly and spoke about her experience with depression and how when she admitted to it, there was support coming in from all fronts, and hence she could sort of come over it. You are somebody who's an anti-depression. You've taken it, you've been through it, and you've emerged successfully as a biker out of it. I want you to share your experience to the audience who's watching us.
Certainly. See, depression is not where you have evident depression on your face. It's not like people can look at your face and say, oh my god, this person is in absolute depression. Depression is a lot more. It's this is something that I keep sharing with a lot of people I interact with. I tell them that it's perfect. Life of a depressed person can be as normal as anybody else. When I was in depression, I was absolutely normal. I would go to work, I would interact with people, I would laugh at jokes, okay? It's not that I was always sorry for myself. It was only when I would go back into my loneliness, when I would go back into my room and I would have nothing else to do, and then I would be maybe 10 degrees lower than my usual self. So depression comes in different forms. It comes for different people at every stage in life. What I would suggest is, or rather what I would share with people is, I came out of my depression because of two things. One, I started pursuing what makes me happy as a person. And second, I started talking about it openly, wherein there was nothing superficial about what I was doing. Of course, I did go on Facebook, I did talk about a lot of negativity, not in detail, but then I concentrated more towards the positive things that I was learning, I was getting to see because of my interactions with people. For those who don't know what I actually did, I went on a ride to create awareness against suicide, against depression, and this all initiated when I initially, when I first thought of ending my life through the same medium. So what I would suggest to anybody who is feeling sad is talk about it, and the others who are listening, please don't tell them to ignore. Please don't tell them it is common. Please don't tell them that you're wrong. Just listen, because a depressed person only wants somebody to understand. Whether you understand or you don't understand, it's a separate story altogether, but please don't shun them. Please don't, shame them. Try to understand emotions. So that is something I would suggest to people who are watching the show right now.
Oh, absolutely. Wonderful point, Sana Iqbal. Isn't it important that, in this day and age when we have so many platforms to keep talking or keep writing or keep expressing ourselves, that it is also our responsibility to keep listening, because there are so many people out there who need to be heard so that something fatal doesn't happen. It is upon us as the people of the society to make sure those who are mentally weak get support from people like us, the listening. And Sana Iqbal, you make that point wonderfully about how it is important to listen. Whether you understand it, don't understand it, don't shun them. If somebody has a problem, it is your responsibility to sit and listen to them. I'm going to bring in another doctor. We already had Dr. Varkha Chulani and Dr. Sagar Mundada making their points. Let me now also bring in Dr. Harish Shetty, who's also a psychiatrist. Dr. Harish Shetty, thank you as always for taking time out to be with us. You've heard two doctors, you've heard people from, you have Sana Iqbal and Siddharth Dudeja, the young people, one in fact who's been through depression and suicidal thoughts, who's emerged so successfully out of it. What do you make of something like, what happened with Arjun Bharadwaj a couple of days ago? In fact, he went on Facebook Live, on a how to commit suicide. It speaks of very dangerous signs as far as the kind of environment that our youth is growing in.
My condolences to the family, and I would not know what happened to him, and it would be unfair to comment on him. But those who would want to die, remember, they have a fracture of the mind. Depression is fracture of the mind. Stress is strain of the mind. Now what happens is most of us say the wrong things to depressed people. Don't think too much. Nothing is wrong with you. Look at me, how good I am. Come on, go for a jog. Go for a run, do yoga. But when the mind is fractured, Sain Dharavi and Switzerland appears to be the same. There's a big load inside the head. It's like a stone. It's emotional paralysis, emotional coma. Depression is very invisible. Depression is very cunning. It comes in various disguises. So it's very important to really make the invisible depression, invisible state of the mind visible, which means if somebody is saying, I'm excessively tired, all reports are normal. If somebody is saying excessively irritable, I don't know why. If somebody is saying I just oversleep and I don't know why. If somebody is saying everything, I am responsible for everything, I think one needs to be very alert. I always tell families that if your family members are missed out on the WhatsApp group, they're not reporting on the WhatsApp, then go to them and ask them what is wrong with them. If in your building, if a family has kept themselves isolated, it's our responsibility to go and knock. If your friend has refused to say hello to you, it's important to go and ask. No, he's not arrogant. It's not his attitude, but he could be depressed. So let us understand that more people die of depression than dengue and malaria. Depression is very common. There's an epidemic of gloom around the country, and it's very important to identify them early and see that they seek help. Now, one point which Ms. Chulani said, that who's there to talk? Actually, we can't blame parents for that. We are in the midst of reckless globalization. Parents have no time. The emotional contact time in the family has gone down. The family contact time has gone down. So it's important that we talk inside the trains. We talk inside the buses. We talk inside classrooms. It's important to talk to strangers and say hello to them when you travel. Make your travel pleasurable. Make your journey happy. Talk to your office colleagues. And remember, a compartment in a train is a mohalla. And that is very important. So let's identify depression early and see that they reach treatment. Depression is fracture of the mind.
Depression is a fracture of the mind. I was just trying to understand what is the crucial role of parenting, but Dr. Shetty, you've just opened up another complete different topic altogether of, why does it always have to be on parents who have probably working 12 to 16 hours a day in these days, as you rightly put it, reckless globalization and the kind of work hours that we have over here. Why can't just regular people in the street be more friendly? That will just save the trouble, and we can do that ourselves. I'm going to bring in Kashyap Swaroop, another stand-up comedian, another somebody from the young age group of 20s who's here with us. Kashyap Swaroop, you've been hearing the doctors, you've been hearing other people on this panel as well. I want to talk to you as two. One, as somebody from that age group which we are worried about right now, the 20-somethings in this country who are busy on WhatsApp and social media. I want you to tell me, how, as you and your friends and all that you've met, you've met as a stand-up comedian as well, where is the problem over here? If you can talk to us as a member of society, as somebody who's part of the extended society of Arjun Bharadwaj, if you can talk to us, tell us where are we going wrong?
So firstly, I just like to start by saying I did know Arjun. I have he's actually been to a couple of open mics. He did try his hand at comedy. So I remember his face, and it's very scarring to know that this guy is no more. So my sympathies to his family. Secondly, I think the problem lies in the fact that we don't even talk about are physiological processes. We don't talk about mental health, we don't talk about puberty, we don't talk about sex, but we have time to talk about a cricketer scratching his crotch on screen, you know. And I think that therein lies the problem, especially when you're just growing, or kind of, this is a very painful stage for every youngster when they're just hitting puberty or reaching their 20s, and these are stages of transition. You go from school to, you know, finding work for yourself, and you don't have many people to really guide you because you're looking for your answer for yourself, you know. So I think if we just start talking about problems such as these physiological problems, mental health, then I think that's where we'll finally strike like a chord or a solution, I think.
Is it also that the people in your age group do sometimes, you know, because of, you know, most of them were born and raised with internet connections in their hands, unlike, you know, one generation before, people like me who didn't have computers for the longest time. We had to go out there and play some stupid game on the play field, talk, fight, you know, have actual, you know, human interaction fights rather than Facebook comment fights or WhatsApp fights. You know, how much of that sort of contributes there? Because my big concern is how much is social media, you know, addiction responsible for, you know, things like depression?
I think Biswa said it best in his Facebook post yesterday. He said, people are just sharing the glorious parts of their lives, and no one is really sharing the sadness or the gloom or the grief. But every time, and it takes us like an incident like this to start talking about it. So I think social media, we should just all ignore. It's just a bunch of you know, things that you don't, I won't say the word, but it's just a thing that you don't really want to focus on. We all really need to seek for our answers inwards, and we need to kind of seek guidance from our seniors also, but always understand that you are the only person who can help yourself truly. You know, you have to understand where the problem lies.
At this point, I'm going to bring in Varun Agarwal, who has been waiting patiently for us all the way in Bengaluru. Varun, thank you so much for being patient. You know, as an entrepreneur and an author yourself, as a young person who has to deal with all the difficulties. I mean, you know, entrepreneurship is not easy. We've seen what has happened to startups, even, you know, experienced people when they do startups, and, you know, when they had to be an entrepreneur, it's not easy at all. And they tell you mental strength is the most important thing for entrepreneurship. As somebody who's sort of, you know, been on that trial by fire, and who's seeing all these, you know, news items, and India fast becoming the depression capital of this country, I want to understand, as an author, as an entrepreneur, as a young person in this country, what are your thoughts?
I think we should change the word depression into something else, right? I think depression gets confused by a lot of other things, because the word depressed in the English dictionary, right, can equal to sadness, or can equal to, you know, just a momentary lapse of something. For example, like, let's say you fail in exams, you know, you hear your fellow friends telling you, don't be depressed. I went through depression when I was in college, and the best part was depression hits you like a disease. It's like pneumonia or dengue. I'm no expert, I'm sure the doctors will know better. But when I was in college, I never drank, I never smoked, there was no access to much social media then. I was doing pretty well in college, but suddenly I was depressed. Suddenly I didn't feel like getting out of bed. Suddenly I didn't feel like making conversations with anybody. Suddenly I didn't feel like doing anything. I felt my life wasn't worth living, and I've had suicidal thoughts many a times. The best part was, I didn't even know that was depression. I didn't even know I was going through depression. I just thought that, you know, I was just sad because I was in engineering, or maybe just I'm going through all of that because of that. But I just wish somebody told me that I was depressed. I mean, I was under depression, and that it's like a disease, like, you know, like pneumonia, and it can be cured by just going to a doctor and speaking to them. The best part about depression is you don't feel like talking to anybody. I didn't feel like talking to my parents about it. I didn't feel like talking to my friends about it. I didn't feel like talking to anybody about it. And if somebody would have come and spoken to me about it, I wouldn't have spoken to them about that at all. That's my concern with depression. It is such an inclusive disease. You cannot open up about it. And it results or blows up into something like the suicide that the kid came up with. I really think it's the parents' responsibilities to check warning signs, remove the stigma that going to a shrink or a psychiatrist is wrong. I still believe 90% of Indian parents think that if you have something wrong with your head, that means you're mad, right? And they would say, if you're going through under depression, stop thinking about it, or, you know, do something, like the doctor said, you know, go exercise or do something else, take your mind off it. No, but depression is not that. You can't do anything. You can't do anything about it. And I really wish Indian parents understand that you need, if you see any warning signs of depression in your child, take them to a shrink, take them to a psychiatrist, do a check. Never let this go, because once it crosses that phase, you will end up in something like a suicide. You can't help it. And I'm telling you this because I've gone through it. And the best part is you cannot talk to anybody. You will not feel like talking to anybody. So my request to all parents out there, going to a psychiatrist, going to a shrink, there is nothing wrong with it. And I believe that depression is just like any other disease. Take your child, if you see any warning signs of depression, take your child to the doctor, get it sorted out. And schools and colleges, please start talking about mental health more. Please start talking about sex education more. There are a lot of children who are students in your school or college who may be going through this, and you can save their lives by talking about it.
What a valid point. Another valid point coming in. Dr. Sagar Mundada, you wanted to comment on what he is saying?
I think Varun has made a very, very beautiful point there. Every day, suppose I go to my hospital, or you go to your office, and your boss shouts at you. You might just go to your friend and tell him, okay, I'm feeling depressed today.
Yeah.
That is a very common emotion that is felt by everybody. There is a difference between being depressed, being bored, being frustrated with today's situation, and being chronically depressed. As he wonderfully put it, depression, like pneumonia, is an illness wherein there is a certain amount of dysregulation, certain amount of disbalance in the important chemicals of your brain. Just for everybody's sake, suppose you consider a car and you consider its engine. If there is no fuel and you tell the driver, okay, now with willpower we have to make this car run, it is not going to run unless and until there is fuel in that car. Similarly, in depression, as Varun pointed out, you just don't feel like waking up, you just don't feel like doing anything, you just don't feel like doing anything. Why? Because the basic fuel that runs your brain is running dry. And unless and until that basic fuel is provided to the brain, the engine of the brain, your brain is not going to come out of it, your mind is not going to come out of it. So you just can't have your way with willpower through depression. That is a misconception that many people have. Being depressed is a very normal thing. It is not it is not a disease, but when we talk of depression as a illness, it is imbalance of certain important fuels or chemicals in our brain. We need to understand that.
That is very clear. Dr. Harish Shetty, you want to comment on that as well?
Yes. In fact, let us screen every student for depression in the city of Bombay and all over. I'll tell you why. If you have pain in the chest, you will go and do an ECG. Immediately. You will not say it's because of gas. Similarly, if somebody is expressing ideas which are very, very negative, dark, let him get screened. Mental health science is not rocket science. It is neither philosophy, but it can be executed by a simple test. PHQ-9, Patient Health Questionnaire 9, is a quick self-administered screening tool to screen yourself for depression. Now, second point, social media. Let's not demonize the social media. Facebook is also a counseling space. A lot of people share their agonies on Facebook. We have saved many lives because people have shared their agonies on Facebook. So let's not demonize the social media. It's important to screen every student. It's important that every college has a full-fledged counseling center. Colleges are rich. They spend a lot of time in festivals, but they don't spend money in building a good counseling center. NMIMS, 9,000 students, but no counseling center, just one counselor.
All right, Dr. Varka Chulani, you want to comment on that? Because one is that you made the point about parenting.
Can I come in here, please?
Please go ahead, Dr. Chulani.
Yes. So I would say, I think a very important facet in the home is food and nutrition and sleep and rest. I think they are the two primary factors which possibly augment depression. Depression is not always chemical. It is often caused by lack of nutrients. And with all of us trying to be size 0 and trying to look our fittest and our bestest, there are a lot of people who are unfortunately going on crash diets, staying awake all night, trying to be socially media savvy, and then compromising on rest and sleep. And if you've got lack of nutrition and sleep, you are compounding an already emotionally vulnerable condition. So I think parental responsibility to see that your children and yourself sleep adequately is imperative. Do not allow your children to go on diets which are unmonitored by yourself, because there are all kinds of new fad diets, and I have clients all the time who have given up carbohydrates to look slim and pretty. And then usually you have mood disorders because of very poor nutrition. So actually the condition can be pretty easily monitored if parents are a little more vigilant. No way am I blaming the parent, but I definitely believe that today as a parent I have responsibility in the way I am monitoring what goes on with my children. 2, it is not as easy as to go around in a train and say hello to someone, because the person who's usually depressed wants a deep connection, not superficial banter and superficial talk. So I think what is lacking today in today's day and age is a deep connect. As I said, it's just not me going and knocking on some neighbor's door and saying, hi, how are you? That's not going to alleviate my emotional troubles. 3, as Sana said, emotionality, unfortunately, in today's day and age is considered a weakness. Nobody is understanding emotionality in the way it should be understood. Okay, and as I said, as a society, as technology is advancing, we are becoming extremely superficial. But actually, the human being is what he was 100 years ago. Nothing has really changed, and it is just the new kind of globalized arena which we are trying to climb into, which is unfortunately causing more trouble. So I think today if we encourage emotionality not as a weakness, not as a vulnerability, and encourage emotionality as a facet of being human, I think a lot of us will do much better.
Oh, absolutely. Wonderful point, Dr. Varka Chilani. Kashyap Swarup, you wanted to comment on that?
Yeah, absolutely. I think we don't even talk about, so everyone's talked about the science of why we get depressed. I'd like to talk a bit about the philosophy of why we get depressed. You know, in school, they don't even tell you about the more significant things about life. We all talk about superficial things, as ma'am said. And I'm sure everyone's heard about the myth of Sisyphus, where Sisyphus, the Greek god, actually, you know, rolls a ball up the mountain, and then he has to come back when the ball rolls down, and that's life, right? You take it up, and then it comes back down, you admire the view for a bit, and then you come back down and you do the same thing again. So life, at the cost of sounding nihilist, life itself is pretty meaningless, right? But the meaning that you give to life is completely dependent on you, and the attitude with which you do things is completely dependent on you. And if anyone tells you that you're not successful, that you're not doing well, just ignore all of that. Just try to achieve what you want to achieve. And I think that in itself will make you a lot happier.
All right. Siddharth, you want to comment on that as well?
Yeah, I think like Kashyap said, like basically I'm 25 and I go through the same thing every day of how, like it's just a sad thing. Like it's just like you go to school, you go to college, then you're just like sad in life after a point. And it's a very transformation kind of a space. But there's nothing, like there's no justification to suicide. I mean, obviously he went through something really terrible, and that's something I can never experience or like think of because what was there in the guy's head. But I just feel that people need to understand that, you know, dying old is a privilege. Like dying old and natural, which is like, if you think about it, a few like miles from here, 1,000 miles, there's the Middle East, there's so much happening in other countries. So I think, I mean, I don't know what the solution to it is, but I feel that suicide is like a major step which needs to be treated very carefully.
You know what, Kashyap and I'm going to come back to both of you comedians in a bit and check a couple of things. I'm just going to take this back to Sana Iqbal. Sana, your point has been very well taken over here. Dr. Varka Chilani backing it up, saying that emotionality and you know, emotionality not being seen as a form of weakness but as a sign of being human is probably the crucial element in dealing with depression. I just want to understand, when you went out on your rallies across and you're going out there as speakers, what do you pick up from the people, you know, especially the youth in the country, in terms of why is India fast becoming the depression capital of the world?
Yeah, it's very unfortunate actually, and if you look at the data, India has already become the capital of depression, capital of suicide. We are on top of all these things. And when I was on my ride, when I was conducting seminars, apart from the students, let me give you a bit of a background. Whenever I reached out to the colleges and I said that I'm conducting a seminar with regards to suicide and depression, a lot of colleges reached out to me and they said, can you replace this word suicide with something else? Can you just rename the entire program? And I was a little surprised initially, and later on I was shocked, because people think the word suicide is a taboo. Just like the word sex, people treat the word suicide as a taboo. In the colleges, the students are not supposed to talk about the word suicide. So, for example, if there is a student who wants to end his life, if he is thinking about ending his life, he already knows that everybody is going to reject his idea. Nobody is going to entertain him, and that is when he would withdraw himself and he would not even talk about it, leading to suicides. So that is one of the reasons. Apart from that, what else I have noticed when I was interacting with students, in fact even now I do a lot of interactions. Just 2 days ago I was counseling a student who just finished his MBBS, and he had absolutely no idea about what he wants to do next. He was not interested in medicine, by the way. So you know, a lot of times the students, they feel that nobody understands them. A lot of times they feel that you know, they have to make somebody understand. Now that is a very difficult situation, because at this time majority of the citizens, they don't have the maturity level to understand emotions. We can understand rocket science, but it is very, very difficult to understand emotions. People become judgmental, and that actually causes more damage, and we see the results already. So apart from this, a lot of love affairs, a lot of failures, betrayal, a lot of people commit suicide. I'm talking about college students only. Yes, they are into love affairs, and they think that that's where the life ends. And then they think that the family is not going to accept their partner because of XYZ differences. It could be religious differences, it could be caste, creed, anything at all. So what I feel is, I think we need parents who are there as role models for the children, and not that parents should think that they are the role models. Children should think that their parents are the role models. It's very unfortunate but true that Indians, especially you know, people from our country, the parents, they feel that they are like a, you know, an instruction manual for their children, wherein they know everything and they tell the children, and children need to follow what is right, what is wrong. Now, the children of such parents, they either become rebellious, they get into, you know, bad habits like drugs or drinks, anything as such, and the other half, they think that yes, the parents are correct, and they take the burden of emotional blackmail. Now that is there. So there is so much of variety when I talk about depression. There are so many students who don't even know what their actual problem is. They don't even know why they are studying a particular thing, and after they finish their studies, they realize that they were in the wrong stream. In fact, one of the cases that I had read about, you know, the girl straight away, she I mean, I really don't feel good about sharing this, but then she straight away blamed her parents, especially her mother, to be manipulative, to have got her into a particular stream. So like that, there are a lot of things. The only solution to this at this time, I feel is feasible, is that parents start talking to their children instead of giving them instructions, instead of, you know, telling them what to do. I think they should start asking questions to their children. Ask them what is it that they would want, instead of just focusing on what their own perspective is all about. So that is one thing. Another thing, as parents, we need to inculcate in our children is that they should always have a plan B for everything in life, and that is where a lot of people fail, because they feel that this is the position they want to reach, and the moment they reach there and they fail, they don't know where to go next. So a plan B, be it academics, be it personal decisions, be it holiday destinations, no matter what, plan B is always a must, and I think this should start from the families. You know, otherwise any other measure may not, you know, be feasible at this time. So this is what I feel, this is what I've observed.
All right, Sana, I know Varun, you want to comment on this, you want to make a point, and Dr. Harish Shetty as well, both of you want to make a point. Just hold on for a second, both of you gentlemen, because we have a caller coming in, Mr. Raj Surana from Kolkata. Sir, please go ahead. Mr. Raj Surana, if you can hear me, please go ahead with your question, sir.
Yes, I must congratulate the TV channel The Mirror Now for having aired this good. Yeah, I can hear you.
Please go ahead, sir.
Can you hear me?
Yes, sir, we can hear you. Please go ahead, sir.
Yeah, I must congratulate the channel for the program they have put in on The Mirror Now. And this is a very good program. It will educate people regarding depression. My question is, when people have the nagging fear of dying, there are people like me also and others also I know, they feel like they will die soon, though they know they are not. I think this is also a sort like depression or like that, or how to come out of it. Sometimes you have that sort of a fear. That's a question.
Dr. Harish Shetty, you want to take that?
I think we all are scared of dying, but if we are preoccupied with these thoughts for day in and day out, we lose our functioning status. We are not efficient in our work. We might get lost. I think you need to explore this thought. Where did this thought really come from? Has it come because your close friend has died of heart attack of late? Is it that somebody, you have attended a funeral of somebody who's very, very close to you? Or is it that you have an illness which you feel you are interpreting it in a very exaggerated manner? Try to reason out yourself. If not, share with your family. If not, share with your friend. If not, share with a friendly neighborhood counselor and get this misinterpretation of your thoughts, cognitive distortions corrected. But if it causes insomnia, if it causes sadness, if it causes just no interest in life, no interest in living, no interest in working, then you should go to a friendly neighborhood psychiatrist.
Mr. Surana, I hope you've gotten your answer. Please do reach out to your friendly neighborhood counselor or psychiatrist as soon as you can. And even as you do that, please make sure you talk your feelings out openly with your family members, with your closest friends, whoever is possible. And if that's not there, do not waste time. Please get yourself to a psychiatrist or your local neighborhood counselor at the earliest. And I'm going to bring in Varun at this point in time. Varun, you wanted to come in as well. Please go ahead.
Yeah, at this point, I just want to say something to our parents, adding to the other panelists' points. There's something that I wrote 2 years ago, and it has been quoted by many school principals and it's gone viral on Facebook. It says, "Dear parent, the exam results will be coming out soon. I know you're really anxious for your child to get a 90% or at least beat your neighbor's son or daughter. It's a matter of your reputation and your standing in society. But please remember, amongst the students who've given the exam is an artist who does not need to understand math. There's an entrepreneur who does not care a damn about history or English literature. There's a musician whose chemistry marks won't matter. There's a sports person whose physical fitness is more important than physics. If your child does get top marks, then great. But if he or she does not, then don't take away the self-confidence from them. Tell them it's okay, it's just an exam. They cut out for something bigger in life. Tell them no matter what they score, you love them and you will not judge them. Please do this and watch your children conquer the world. One exam or a 90% won't take away their dreams and talent." Having said that, I think the conversation that has been happening amongst all panelists, I just feel that depression is very black and white, right? Depression can happen to the best of people. Somebody like Deepika Padukone underwent depression. She's a famous, successful actress. So I really believe that let's start treating depression like a disease. Let's start calling it some other name, and let's start treating it like it's pneumonia. And let's start saying that if you're depressed, just get help. If you're going to look into all the factors that come into, how do you get pneumonia or a dengue, then the conversation will never end, right? India has actually always been a big hub for depression. The reason why it's coming out now is that people are talking about it. But I really feel that let's treat depression as a simple disease. It is a disease, needs to be spoken like a disease, needs to be treated like a disease. We could get to causes and symptoms and all of that, but that's never ending. Depression comes to the best of us. Depression can come to anybody who's supremely happy in life and suddenly can get depressed. Let's treat depression that way. Let's treat it as a simple disease. Let's not create too much of hype around it, and let's be more self-aware. Let's be more especially when it comes to children, look out for the signs of depression, get them treated. That's about it. I think we're just overhyping this whole thing.
Look out for the signs and get help soon. That will be step number one, and that's something that we would like to see. That's what I'm going to bring quickly. I want the doctors to give their quick takes to people watching. It could be people watching means they could be under depression, or they could have friends under depression. What are the warning signs? What are the signs, and how soon and how easily is it for them to get help? I'm going to start with Dr. Sagar Mundada first, and then Dr. Varka Chilani, and then Dr. Harish Shetty. Sagar, go ahead.
I think 2 to 3 points really need to be taken care of. I think when somebody starts getting depressed, one of the most early symptoms is that your sleep patterns really start becoming very fragmented. You don't feel like sleeping. When you try to go to sleep, you don't get sleep. If you do sleep, you'll wake up 3 times in the night. When you wake up in the morning, you won't feel any kind of freshness. There'll be a lethargy. You'll be so lethargic that you won't feel like doing anything. That is one of the earliest things. Secondly, what I need to tell is that suppose one person, suppose we have a comedian here. He loves to do comedy. That is his passion. Now, a comedian who's depressed will not like to do comedy. Things that were his passion before will seem worthless to him.
Exactly,
will seem totally
yeah,
worthless
yeah.
to him. So your passions will become, you won't really like to do them at all. I think that is one thing that you really need to look at.
Yeah.
Apart from that, if you keep feeling sad irrespective of what is happening throughout the day. Suppose I think that I'm very depressed. I meet Amitabh Bachchan tomorrow. A normal person would have a feeling of exuberance, a feeling of elation when I meet such a personality. But a depressed person, irrespective of any positive event that is happening around him, will still feel low. I think if we can focus on this, we will be able to catch it early.
All right, Dr. Varkha Chilani.
Yes, I think I'll take off from Dr. Mandra and add to it that it's not only about not being able to sleep. Sometimes you oversleep and you sleep too much and all you do is keep sleeping through the day. That itself is a wake-up call to someone to notice that why has this person's personality pattern of sleep altered so drastically that where he would sleep 7 or 8 hours, he's sleeping possibly 10 or 12. In children and teenagers particularly, signs of unnecessary irritability, snapping at the parents, withdrawing, not going out, keeping away from friends. Okay, these are consistent patterns that one needs to look out for. Sometimes you have excessive TV watching, overeating, constant shopping, constant wanting to be engaged in something or the other. It could be a desperate attempt by a person to get rid of the emotional anguish that he's going through. But I think one of the comedians, I don't know if I've got Siddharth's name correct, he used a wonderful word. He said, what is the philosophy of depression? I think Sana used it in her life unknowingly, where because she gave herself a purpose to try and reach out to other people to help them out of the condition that she had gone through. She used Dr. Viktor Frankl's logotherapy, which says that if you have a why to live, you can bear anyhow. So I think engaging and asking people who have suddenly become disengaged is a third sign that a person wants to look out for, where a child has been pretty active, engaged with socializing, going to school, doing reasonably well in school, and suddenly you see that there is chaos and anarchy in his life and everything seems to be falling apart. I think it's time for the parents to sit up and take notice.
All right, Dr. Hari Shetty, I'm going to come to you because right now we have a couple of callers. We have Ahmed from New Delhi. Ahmed, please go ahead.
Hello, I want to ask the Dr. Barkha, I think his name. I want to ask whether psychotherapy or it is the medicine which is more important in the long run if a person is suffering from depression from 10 years or 15 years, because if you take the medicine, it has a lot of side effects. So what is more effective in the long run for the psychotherapy or the medicine?
It's not the...
Go ahead, Dr. Chilani. And then we'll take Mundada as well. Dr. Mundada as well.
No, it would be unfair to say either or. It would be unfair to say either or. I think what has to be first ascertained is the cause of depression. Not all depression is chemically caused, and unfortunately people are not aware of the difference between a clinical psychologist and a psychiatrist. So I think the first thing would be a correct diagnosis. For example, if the person has failed an exam, he or she is not depressed because of a chemical imbalance which has caused that condition, but because of a feeling of self-worth, self-loath, inadequacy which causes the depression. That needs good, intense psychotherapy by a trained, qualified therapist. But today, for example, if suddenly there has been a chemical imbalance, then maybe we look at medical treatment. Ideally, a good psychiatrist and a good therapist ought to work together, where a psychiatrist does not hesitate saying you don't need medication, please go for therapy, and vice versa. A good therapist says, you know what, I've worked for a couple of sessions, I don't think you're doing too well, I think you need medical support, and sends the person to a psychiatrist. So there is no hard and fast rule here, sir.
Right.
It would be a good diagnostician, a good therapist to be able to make that distinction whether the depression is chemically caused or attitudinally caused.
All right. In fact, we have another caller. This one is an anonymous caller from Mumbai. Please go ahead.
Yeah, hi. I want to know how do you handle situations sometimes which are completely out of control? For example, maybe a family member has to go to jail. Now, how do you handle this? There is this situation which is going to disrupt the entire family. Maybe there will be maybe the parent will commit suicide or something like that. How does the rest of the family handle the situation before the event happens, that is before the person goes to jail, and even after that?
Dr. Harish Shetty, if you want to take that.
Suicide pacts are known after a severe traumatic situation. I think what is very important at that time is for the family to seek counseling immediately and not wait for astrologers and not wait for faith healers. It's important that they really go and express their feelings as it is. See what they think about it, and the counselor or the psychotherapist would be able to actually help them deal with the situation. Don't hide yourself from the world. You may hide yourself from the world, but don't hide yourself from the mental health professional. And that, I think, is very, very important. Apart from that, the symptoms of depression which we have been speaking about, I think I am a burden on this earth. I want to run away from home. I am responsible for all the trouble I caused to my family. I want to go to God are some symptoms which you have to be very careful. In children, pain in the abdomen, pain in the head without any physical illness. Not wanting to go to school. Phobia or phobia to college is also a sign of depression. Also vague aches and pains inside the body, throughout the body, and excessive fatigue without any physical cause are some uncommon signs of depression which we need to really look at. Sometimes some young boys or girls, when they feel very depressed, they might want to commit suicide. They might give chocolates to everybody and say, bye, I may not see you again. Take this very seriously. Screen every suicidal thought through a mental health professional. And also what is important is that we are trying to live 100 years in 10 years. The brain has not changed. Depression is caused because we are stretching ourselves too far. And what is very important is there are many people inside homes who are lying alone. When I said you need to go and knock, I mean healthy people should go and knock at people who are withdrawn and should help them come out of depression or see that they go immediately for treatment. And lastly, disconnection is a consequence of globalization. It's worse than HIV. Stress and depression is a consequence of disconnection. While traveling, let us reconnect so that we remain healthy. Emotional hygiene is important. Taking care of emotional hygiene can prevent depression in many.
All right, so I'm just going to end this entire discussion. We've heard the entire medical analysis of.
I have a question.
Varun, go ahead.
I have a question to all the doctors here. See, because I've gone through depression and I know people who are outside cannot gauge it. So my question is, let's say somebody is going through depression, right? Now the symptoms of depression are very confusing, right? For example, if you're waking up late or you're sleeping early, your parents blame it on your phone, right? For example, if you're feeling worthless, your parents blame it that you're not ambitious, right? The symptoms of depression are very confusing to a parent. They think that the child is lazy, or the child is non-ambitious, or the child is too much on mobile phones, or the child is hanging out with too many friends. So they blame all the symptoms because of that. How does a parent accurately gauge that their children may be going through depression? And how is an accurate way for them to tell that this could be early signs of depression and not blame it on all the other excuses that they usually blame it?
Right.
And how do they break the stigma of going to a doctor and getting that checked?
Right, Dr. Harish Shetty, we have 30 seconds left on the show. If you can give us a quick answer in 30 seconds.
Parents need to not diagnose depression. If they have any doubts, please rush him or her to a friendly neighborhood psychiatrist at the earliest. It's his job to find out if there is depression or not. And for all young boys and girls, there are many boys and girls worth living for, no boys and girls worth dying for. There are many exams worth living for and no exams worth dying for.
Well put to every single young person watching. I wanted to come back to
answer. I have a second to come in.
You are 10 seconds, ma'am. Last 10 seconds. You have exactly 10 seconds.
So, Varun, I'd say that unfortunately we parents are extremely judgmental and we make a lot of assumptions about our kids. The best way, I think, to check whether your child is undergoing depression or not is to hopefully have engaged with him long enough to know whether he is on the phone, whether he's not ambitious, etc. So I think a kind of a one-to-one, a deep interaction with parent and child will give the parent a perspective whether this is really an alarm signal or not.
Absolutely.
In this situation, parents should rush to the doctor and not wait for too long. Let the doctor screen whether it's depression or not.
All right, very clear. There's no doubts over here. I'm going to thank each and every single panelist, the two comedians we've got, the doctors we've got, people who've been through depression, who are now campaigning against depression. Thank you, all of you, for taking time out to be with us here on the Urban Debate on Mirror Now. And with that, we need to wrap the show up. Thank you so much for watching. This is Krishna Kumar saying good night.